comprehensive stroke center becomes very important for us, where you have these facilities and time is not wasted. So, for example, if you go get an imaging done in diagnostic center and then has to be transferred to a hospital, and especially in cities like Bangalore, where traffic is always a problem, the importance of such things needs to be again ascertained that we need to have a comprehensive, the patient has to go directly to the comprehensive stroke setup where all of these facilities are available. And what do we do? If we detect a large vessel occlusion, as I said, these procedures are called like the angioplasties and stenting which you have heard for the heart. Similarly, these procedures are done for the brain. Basically, it's a blocked pipe. In simple words, we use special materials or catheters or stents to remove those clots from the blood vessels. The main idea here is to help the remainder of the brain. So normally when the artery gets blocked, it might be supplying say 100% of that area. One road is blocked which is leading to 100% of the area. As the patient comes, say there is only 10% of which is damaged. So we have some 90% of the brain yet for us to save there by opening the clot. So what the emergency procedure which we do is like a plumbing job where we go and remove those clots from these arteries using specialized materials which could be stents, which could be catheters, and the procedure which is called as the mechanical thrombectomy. And as I said, this is done as fast as possible so that we save more amount of brain, so that the recovery is faster and the damage to the brain and the disability which occurs because of that is limited. Once this procedure is done, there is rehabilitation which takes place. The patient now has to come back to his normal life, which basically will include right from beginning. He has to relearn what he has learned in the past. That could be in terms of weakness, which he has had produced because of the stroke, that has to improve by doing physiotherapy. It could be the vocational rehabilitation, where even to stand, as I said, we saw in the BFAST, there is a balance. Those things become important. So just to have balance, to have cognition, to have proper emotional, to have proper thinking capabilities, all of these needs rehabilitative measures, and that's where the rehabilitation becomes important. Even to swallow, once you have might have had stroke and you might the patient may not be able to eat quite well, and to establish all those things also require a lot of time. So this rehabilitation program also becomes quite important. There are a few subset of these people who may have large stroke, and because of that may end up requiring emergency life-saving surgical procedures, which we call as decompression craniectomy. Maybe Dr. Abhishek can